So the third keynote that we are going to have here at the ISD 2021 is an example of how the efforts of the scientific community can be directed to fight one of the major challenges that affected the whole world in the last century, that is the COVID-19. It is my pleasure to introduce Alberto Conejero, who is a distinguished scientist from our university. He is full professor and director of the Department of Applied Mathematics and professor also of data science projects here in our School of Informatics. He is also director of the master program of mathematical research at the university. He investigates questions of pure mathematics and their application to physics, biomedical data analysis, image processing, and communications network design. Probably most of you already know the XPRIZE, which is a non-profit organization that designs and hosts worldwide open and public competitions included to encourage technological development to benefit the whole humanity. For this competition, Alberto has been the co-leader of the Valencia IA for COVID team, which won the 500,000 XPRIZE Pandemic Response Challenge in March 2021, so a few months ago. This was a challenge focused on the development of artificial intelligence-driven systems to predict COVID-19 infection rates and also to prescribe intervention plans. Valencia AI for COVID, the Valencia AI for COVID team is a research group that was formed by 20 experts from universities and research centers here from the Valencian community to fight against the COVID-19 and for future emergencies that can arise through innovation and scientific evidence. Alberto has been also the instructor of the Valencia UPB team that won the grand prize at the undergraduate level at the IG competition of synthetic biology in 2018. In this talk, we have the honor to hear from a very first-hand his experiences and also his views on how the artificial intelligence-based system or information systems can be built and also can be used to fight threats that affect the whole society or the environment, and in general, that can help us to improve the quality of our lives. So, Alberto, the floor is yours, and thank you very much.
Thank you very much for your nice presentation and for your kind invitation. It is a pleasure to be my first in-person conference after a long time ago. Moreover, being also a keynote speaker. What I'm going to speak is about COVID-19, but from the point of view of the experience that I have been working in this topic, contributing to the Valencian government to fight against the COVID. And in particular, with the result that we obtained with the XPRIZE Pandemic Response. So when I went to talk sometimes, and some remarkable people to introduce themselves and maybe sports, or they have a small video to introduce. And I say always when I see this, okay, what formidable they have prepared, they can introduce, they have the material. And in our group, we also have a small video to introduce our work and our team. So this is just 1 minute, and I'm going to put it in order that you can see it.
In March 2020, the world as we know it was turned upside down. Our social relations, our joy, and our way of life were put to a halt due to the coronavirus pandemic. We suffered, but we did not give up. We decided to work together, to adapt, to move forward, to redefine our lives, and to continue creating a better world while living with the virus. We are Valencia IA for COVID, a group of scientists and researchers aiming to have a positive impact on the world. We have been working together since March 2020, helping the Valencian government make better decisions during the pandemic using data science and AI. The XPRIZE Pandemic Response Challenge, sponsored by Cognizant, has offered us an opportunity to expand our work. Would you like to know more about it?
So this is a brief video that we elaborated for participating in the competition, and it's so in order, if you don't want to follow the rest of the talk, you know what it's about. So now I will enter into the details. So
in March 2020, the world as we know it.
Good. So I have structured the talk in two parts. We have been working as members of the Valencia Data Science Task Force team since March 2020 up to date. And during the period of December 2020-2021 March, we were participating in the challenge. So for explaining the second part, I will explain what was our path, our motivation, and what we learned in the middle before being prepared for participating in the competition. So the work is that I'm going to present in the second part. This is some paper that has been accepted already in this conference about machine learning. It was awarded the Best Paper Award. And in fact, this will be it will be even presented here before in that conference. So you will have it from the very first hand. So let's go to speak about the task force. So when last year in January, when we started to hear about COVID, news that we have from China, later that came from Italy, it seemed that this was like a train that was going against us. And the closer that it was moving the virus, we have the feeling that it will arrive sometime. The first, one of the reasons that I was involved in this project is that since the very beginning, we were interested in the part of about what will be the impact. It has been a contribution, many more from mathematicians and physicists, to predict what will be the impact, because it was quite easy to model what will be the projection of the pandemic. After 1.5 years, we almost know that the behavior is exponentially, and we have waves, and these waves have to be controlled. Even at the very beginning, it was this, I think, around the 20th of March, we already organized the first talk about COVID, and because Victor Lucivero, who was Italian, and he was already modeled what was expected to happen in Italy. And it helped us to know exactly what was happening. And we also started to see that this will be a source for doing research, not limited to people who was working in medicine. Because we can work with data in these models, and these models can have impact. And the first very basic approximation that he did was to use Gompertz equations for the accumulated cases of cases and deaths. And it can be easily seen from the very beginning, and look that these results were already in, the talk was in at the beginning of March. So here what we have are the projections of what will happen. If you see on the left, what we have is in black mainland China, in blue Italy, and in red Spain. And also, when we were doing the fitting, it was expected that when doing the fitting for Italy, it was expected that we will have a number of deaths that will be around of the order between 100 and 1,000, around 500, 600. So these predictions with very few data and doing a fitting were anticipating what will happen in a very short future. And even here in Spain, one of the first groups was the physicists of Alex Arenas, who made a map in which they were seeing what is the prediction of collapse of the ICUs units. So this is something that with very few data, we could start to have the vision that we will happen in a short future. This was because of it's quite a very basic model for modeling epidemics are SIR or SIR compartmental models. These models you probably have, if you have seen some part about modeling, they are very basic, and they were first motivated by Kermack and McKendrick in 1927. I'm going to explain, I'm a mathematician, I have this deformation, so I have solved lies in which I will speak a little of mathematics, but very basic. So we have three equations, three variables, three states, susceptible, infectious, and recovered. So the thing is that the susceptibles, or the increment of the susceptibles, will be in terms of the product S times I. And the product S times I means that people who is susceptible is interacting with people who is infected. If you have more people susceptible, many more people will be infected. If you have a lot of people that is infected, many more people will be infected later. And what is really interesting is how do you fit the beta? The beta means about these matches between infected and non-infected people, what part will be later infected, right? And the beta is very important. You will have heard in the news about the R0, which is the increment. The beta is not exactly the same. It means if you have these interactions, how much will provoke an infection in the future, okay? Later you have, okay, so these models are nice because, or I like, because when you're formulating the equations, you know that you are wrong or not. Because everything that is decreased from susceptible will have to be increased in the infected people, right? And also the infected people, at some rate, they are recovering or dying. We simply denote it by recovery, okay? So the thing is that if you see the classical curves of the evolution of these curves, is that when you arrive to a point, the infected are not increasing anymore, and they are decreasing. And usually you start to have these results about the 60–70%. That this is the reason that people usually speak about the herd immunity, because you don't have any more people. So the number of susceptible is decreasing, and despite you have a lot of infected people, you cannot increase the people who is infected. Okay? These equations, usually when you study the degree of mathematics, or some years ago, the people doesn't pay attention to this. And when you study engineering, you probably see differential equations with cosinus, tangent, exponential, and these are very basic, and it's a pity that they are not paid full attention even in engineering courses or in mathematics, because they are very fruitful. Even if it works when you are modeling chemical reactions. Because when you have a chemical reaction, two species are interacting and they are providing products. And this is the basic principle of this mathematical model. However, in the last years, they have been, even before the COVID, they have been more known or more work because maybe some stupid reason that is related with zombies. Some years ago, some researchers decided to publish a paper about infectious disease modeling, and they were trying to introduce to the general people these models through zombies. This was about the emergence of Walking Dead and so on. So it was nice. And the thing in this paper, they explained that, okay, if you have the data, you can make a more accurate description of the process. But what you need is the data and the assistant that provides this data. So here they started with the state of susceptible, zombie recover. You can be infected but not yet a zombie. You can be infected and be in a quarantine. or there are zombies who are died, later they can be born again. So if you like zombies world, you know exactly that there are models that can inform you about what is expected if we have an outbreak. But what I want to say is that I like to speak about this because this is a good example of communicating science in a funny way, and it has permitted that many people got interested in the topic and know the tools. Okay, I know this, and before the COVID, with some colleagues from computer science here, we are starting to use these models of compartments, of boxes, where people is moving from one to the other for studying communications, and for studying communications between cell phones. So the thing is that you have the simile is that you are susceptible if you don't have a message, you are infected if you have a message, and the cell phones can communicate information between them. So compartmental models, they are not limited to the impact of infectious diseases. They can be translated or transferred to other situations if you have different states. As long as you have different states, you can model it in a very basic way. And now let's speak a bit about COVID. So in the first days of the outbreak, all the people was very crazy. The hospitals started to be in collapse, and people have the need that they want to know exactly what was happening. And people feel the right that they want to know the information about what was happening and when it's going to collapse. So in this case, the accuracy of these models at the beginning, it was just for 1 week or so, with quite a level of error. They know that they increase or they decrease, but quite inaccurate. A very good model could be done if your system has updated information, for instance, of different states. Let us go to review what are possible states that we can inform, such as we are susceptible, we are exposed because maybe we are not confined and we are moving to outside the streets, right? We can be infected, but while we are in a period asymptomatic, later we can be infected and we develop the symptoms of the disease. We can suffer a little and we can be recovered, or we can go to hospitalized in ICU or not, with good prognosis or not, or we are going to be about to be dead. So this could be the flow. When you are doing the models, you rely on the data that you have. The better you have the data, the more updated the data, the better models you will have. But the first sources were about the Johns Hopkins University, a center of information, and from the almost January, they were providing the information. Even in February, when I was teaching the subject of the projects on data science, we heard about this, and before everything was arriving to Spain, students started to work with this. And this was a very good source, and it has a very good impact to provide insights for all the world. I think that this is a good example of how to develop an information system with a worldwide perspective can provide a very good reputation to the institution, as it is the case of the Johns Hopkins. I will later speak about another case of also. But the thing is that it's important that you try to facilitate, try to integrate, try to look for collaborators that can join the information. In this portal that you probably have visited, you have information about worldwide. There are collaborators which are taking care about the sources and how to update the information. In Spain, at the beginning, the sources were from the Instituto de Salud Carlos III, who was gathering information from different communities. We have a problem of communication because every community was collecting information in a different way. The criteria about when some people has or doesn't have, it was a little unclear. And this is one of the last screenshots. Now it's organized, but at the very beginning it was just with PDF. They take some time until you were providing the CSVs and so on. And at the beginning, we started with almost very few data. We also have the MOMO, but it has a little delay. And this is one of the sources which is very well structured because all the people is annotating when the people is dead. The problem about to use this data is that this data is at the end of the illness. And maybe it's, yes, because you are, you have the case, you are hospitalized, and maybe you are dead, and in the period, maybe it can happen 30 years, 30 days or so. But in the Valenciana, now there is a good portal, but at the beginning we have also the information very, very scarce. What happened for me with the data? So after having heard these talks, I had the feeling that the responsible man only can, and if you are not a practitioner, the only thing of a physician, the only thing that you can do is to stay at home and not to do anything, not to spread the illness. So here, there was a project a couple of months ago. Nuri Oliver, who is on the right, started to design what is the, he was commissioner of Comunitat Valenciana for Artificial Intelligence, and she started to design what would be the structure. But it happened all of a sudden the pandemic, and she has experience in Telefonica and Vodafone modeling with mobile data the spreading of the epidemic. So she transmitted the idea to the Chimopuch, to our president, and she contacted with Anna Berenguer, who is Secretary of Social Policies. And during this period, the task force, Anna Berenguer, who is a politician, has been involved in the work of the task force, who has been very fruitful because it has given us to try to attend the political demand about what information is needed. But what is important about this is that you pay more attention about what is important to the rest of the society and not what you can do with information, not what you know. And you try to, you are a little exposed to try to give answers to questions that probably you are not thinking because you are thinking inside your box and what you already know. So I have information about these groups, and I joined to them, and this is the group of experts that have finally configured this group. Here from the Universidad Politécnica de Valencia, I am Alberto. It's also Miguel Rebollo, who is from the brain, and also Oscar Gari, who is hired now with Laura Sebastián, and other people from my institute in applied mathematics, Miguel Ángel García Mar, Eloy Piñol, and also former students of myself who were not just in the university, Manuel Portoles, who was participating in other projects with me, and also we have even someone from communication who was studying a student of the Master in Transmedia Communication in Andia, Victor. So we were participating, and the thing is that this group has been trying from the beginning to contribute to solve a problem, and we have a Slack channel, and it seems that it's like if you were working with the door open, anyone who can contribute and can work was welcome, and depending if you want to continue or not. And during this period, so we were the people who will follow in this. So the thing is that our reports will synthesized and presented by Nuria Chimopuch, and she was participating as one of the members of the panel. So in the end, our contribution was formally presented in the weekly seminar that we have, and we were working in this way that during the pandemic. During all this period, of course, we were complaining about how bad was the information system for providing the information. And because we think that for answering the questions, we need data, we have very small data, very few data. And it seems to us that we were like with a hammer, with very few data, bam, let's go to see what is happening or what is appearing. But things go better in the end. So very briefly, this is an overview of our task force. We were working with mobile data analysis, mobile data for doing analysis more related with the part of movement of people, right? We were also working, I am mainly this part of epidemiological models, at the beginning with these CSI models and later with more advanced based on deep learning that I will comment at the end. Predicting models for the occupancy, hospitalization, and ICU occupation, number of deaths, and citizen science through a poll. I will comment some. So the thing is that in this part, okay, so if you want to do things, what you have, what are the sources, and what can be done with them. From the part of the data from mobility, this is even one part that was more in the syndrological, not related with the medicine, but this was the more well accessible in the following way, that in November 2019, there was a study about mobility, and it was thought about proximity mobility. So the thing that, so there's a data available. Nuria Oliver also has contacts in Vodafone, Orange, and she tried that they share for free the data about how was the mobility. So with this, there was a project with the ministry that they shared information and people started to do analysis. We discovered that because of the anonymity, it was very bad data in the following sense. This is a structure in the small regions about 5,000 people, and you only have records of people moving from one to the other region if you have a minimum of 100 people. So in some cases, it's very limited data to know exactly what are the movements. And it was more related to people, and the data, since the project of 2019, it was related about you are in a zone and you are moving to another zone for some period of time. And they were trying to identify where you sleep and where you are spending the whole day. So, but in any case, you can do things with this data, and you can try to see what is the evolution of the percentage of people moving out of their residence. So this could happen as a measure to see what is the effect if the measures are verified. And later you can try to integrate, or it was our expectation, to try to identify with this parameter beta that can model what is the interactions of the people, right? Also cases of use of this data to impact the containment measures, to identify areas where these measures have less or more impact, to impact reduce mobility, impact the spreading of coronavirus, and the community rotation. This information, we organized some portal in which all this information was aggregated and shown, to make it accessible and people that later can load information and visualize. And it was very interesting to use this information because it can give to the people who take decisions about what regions should be confined and how you are taking your decisions. So for instance, here in Valencia region, we have 3 provinces. One is Castellón, in the middle Valencia, in the south, Alicante. But here with this mobility data, in each color, we have a different community. You realize that this part of Alicante is not strongly or is not connected with this part. So if some part of the spreading you have in this area, it's advisable that you try to cut or confine or limit the movement between these areas. For instance, another case is, for instance, what happens in the south of Valencia. This part is not directly connected to Valencia. So probably you can cut and try to separate in this area. And even in the part that are this region that is already in Valencia, it's more isolated and in some cases can be even more connected with Alicante region. We also saw the importance that in the middle, the region of Játiva has in the connection and in the spreading. It was like a channel of transmission because of the people who is traveling in the interior. And this is one of the reasons that supported with this, the strategy of the local government was to take the decisions for health areas. We have 23 health areas, and they decided that the information will be based in health areas and not in another type of information. Also, you can try to rely on physical measures like the entropy in order to see exactly what is the mobility and to see the evolution at different levels. And this is here a visualization where you can see that in the parts that we were confined for more strictly confined, so the mobility was reduced. Later, we also developed predictions of ICU occupations. And one important thing that I think it could be of interest for you is about the COVID impact survey. So the thing is that at the very beginning, you don't have any data almost, or very few data about the cases. So one of the ideas that was suggested is, okay, let's go to make a citizen poll, and people will have to fill information about if they want to, if they are contacting with a lot of people or not, the number of people, if they think that they can follow and to keep on confined for some period of time. So this type of study, it was started with WhatsApp communicating to all the people, and some of you, if you are from Valencia, you received this information. It also was paying with advertisements in Facebook and other platforms. And the thing is, you can be very critical and you say, okay, people can fill it 2 times. People can lie. You are not knowing if there is a bias of this or not. But the reason is that if you don't have any data, this is a good way of having quick data. And it has been very reliable data to take decisions. For instance, with these decisions at the last part of 2020, we see that the effects that have the confinement, the close of the bars and restaurants in Catalonia doesn't have the expected impact because the people was not limiting the number of contacts. So at some point you can have and you can rely on this. With all the limitations that we understand, even you needn't to register. This is something that you still press in COVID impact survey, you can fill it and you can answer. And this has been a poll that has been the one in the world with more information. So this is something that is just to think twice, but maybe one of the things is that if you don't have anything, try to get something because maybe the necessity is the trade-off could be interesting for you. This information later, so it can have answers about the behavior in different communities, about the socialization, so you can see the number of contacts. You can see also the people in which places they are taking the contacts, so you decide if the actions of closing some type of places they are taking effect or not. So very interesting approach to attack this problem. If you want to think another type of sources, one of the portals that has many of them is the Trinity Challenge, and you have lots of, they organize a challenge and they have provided a lot of data sources or reference to another information system that can be also of interest for you. Okay? Good. Also, as a side part of another approach is to try to predict, try to cluster the symptoms. In this work I participated, this is a side project where I participated with people from the university, from a group in biomedical data science, so try to structure what are different groups and the prevalence of different symptoms in the groups. And also we noticed that you have to be careful when you aggregate data, because even data that could be related with clinical information, there is a bias, or you can find bias in the interpretation of the information or the reporting or how it's affecting each population. So for instance, here, if you want just to pay attention to this graph, so what you're seeing is that the information that we have about Philippines, the people or the illness was attacking in a different way. So you have to take care when you are aggregating different databases, your eagerness to have more and more data, that there could be possible bias in order to take these decisions. Well, but these resources are connected, but at some point we were presenting measures in different aspects, but we wanted somehow to try how to integrate all this and to provide and to see what is the connection of one decision directly with some other parameter. Returning to these models, so the thing is that everything we saw about mobility, about taking political decisions, what is the effect in this data that will provide the rate of contact and which ones are converted later in infected people. One option is that I think that is will become increasingly important is agent-based modeling, in the point of view that you can speak about this part of the digital twin, so that you have like a digital a digital twin of a society or a region. This was one of our former approach, but we were we don't know exactly what was the information exactly or how to model it. Was to be something that it has to be built. You realize that you need a lot of time to have one of these models. But in the future, I think that it could be a perspective because we all have different behaviors and to try and average to have an overview of what can be provided. So there also have been some works fully published about this. In our cases, we have the feeling that for fitting a compartmental model, we have too many parameters to adapt, and you are not relying enough if you will know exactly the contribution of each part to each factor transition. Good. So for this, we arrived to the point almost in here in Valencia, the second wave started to appear or almost at the beginning of August, September, and we were continuing reporting and we discovered the pandemic response challenge. So this was a competition organized by the XPRIZE Foundation, and the XPRIZE Foundation has the idea of there are technological issues, so let's try to gather money and to try to motivate people to try to work on a topic on a short period or a long period of time to try to advance. And we saw this and we like very much because we say that we have been awarded with 2 national projects and we say, okay, we have almost done the work, we can repeat this, but let's try to think a little more because we think that this was a good idea. So they have already organized one for design of new generation mask. And if you want to win money, there is a $100 million prize for carbon removal that is supported by Elon Musk. So this is a nice way. And the good thing is that if you think about, you give a second thought, forget about the money. But this is a really interesting problem if someone puts so much money. So maybe just working on this topic would provide you later, or you are catching attention to what are interesting problems. At least being a mathematician and not expert in different fields, but in an abstract part, for me, it's a way to understand if it's worth attention to work on this or not from outside. So what is the description of the challenge? So it was based in a paper that was probably a preprint uploaded in archive in August, and that these people was working for Cognizant, some of them. So the idea is the following: you have a context, which are a number of cases, and non-pharmaceutical interventions. Non-pharmaceutical interventions are decisions that take the governments to limit the movement, to impulse vaccination, right? And what the idea is that you are going to prescribe what the government has to do, and this will predict the result in terms of the cases, right? So this is the scheme. So, well, here we have a trade-off. We have a trade-off that you have heard many times, and you will have your personal opinion about health and economy. And it's clear that it's a trade-off because you cannot be focused just in one of them because life has to continue. So the thing is that for this trade-off, what we have is they mention the portal of the Johns Hopkins University, information about cases. Later, they have incorporated vaccination all over the world. And a very interesting initiative is the Oxford Government Response Project. So they decided in Oxford to gather information about how governments were responding around the world to the pandemics. How do they gather the information? So let's go to speak about non-pharmaceutical interventions. What do governments do stop the spreading? You can close schools, close workplaces, cancel public events, restriction on gatherings. Do you see it, Indian? Or I'm reading in order that you know. Close public transport, stay-at-home requirements, restrictions on internal movement, and international travel controls. And they categorize for every country and every state of the United States and regions in England, each day what was the decision of what was happening in this country. So you will have, for instance, for a school in 4 levels at most, very basic and very easy to understand. So a school closing, you can have, for instance, 4 levels. No measures, recommended closing, required closing at some levels or at all levels. Another one, workplace closing. You can take measures, recommend closing, require closing for some sectors or for all but essential workplaces, and so on. And in the end, they have also information about if people is wearing masks or not, if people are, how many slots of people are vaccinated. But the thing is that it pay me attention because from experience with data science projects, if you have categorical data, you think that sometimes you can only do pie charts or you can do histograms, and it seems you can do very few. But the thing is that they have this information for every country every day. There was a very big amount of information. And the thing is that they want to interact or to combine this information with the number of cases. So we say, okay, this could be good because this can help take decisions. In fact, you can visualize this. For instance, this is a way of showing this that we do it with Tableau, where you have a number of cases, right, dates, and you can try to identify which are the different levels that you are taking each one of the measures. So you can try to have it this for all the different periods of times, and you can visualize this. So now, what is the interest? Okay, if I'm taking several strategies and I consider a strategy, I decide to recommend a school closing, but I will open only, for instance, all the work at essential workplaces. I cancel the public transport. I recommend people. So each combination of decisions, I want to predict what impact will have in the number of cases. This was the commitment of the challenge. So the thing is that you can try to work and to play with different decisions of what will be the expected impact. Here we work with the number of cases, but you can do the same with the collapse of hospitals or the number of deaths. And this is, I think, the most nice idea that I found, is that you don't have a right or a unique answer. You have a Pareto approach. So you have a pool of decisions, a space where you are projecting the decision, and you are trying to take the best ones. So here we have the number of cases, and we have the cost. By cost, we understand that very simply. A school closing, just to follow the law. Cost 0 if you don't take measures, cost 1 if you recommend closing, and so on. If I combine the two measures, this decision and this decision, cost 1 and 2, 3, right? Next step, if you have a good information system that can evaluate the impact of closing the school one day, you can combine even social cost with economic cost. But right now, if you want, we just are counting, okay? So the thing is that there is an optimal, here we have the cost or the stringency, how hard is to close with the number of cases. If I want very few cases, the cost will be very high because I will take very strong decisions. If I take very few decisions or very loose decisions, the number of cases will increase. In any case, what I want to find is what is the car in which the trade-off is optimal. And later, if I present this information, someone else can take decisions. The politician can give more importance to the number of cases or to the cost. This is his decision, her decision. But the thing is that as long as they are taking in this Pareto front, they are optimal. So sometimes we are asked to give a unique decision, but in this way you can provide a pool of decisions and later they decide what to take. And this was nice because we are not responsible. We have been working for almost 1 year and we were not appearing in the newspaper saying someone will die at that time or number of cases We have tried to be quiet because what we want is just to contribute and not to have this impact. So very important idea that I think is the Pareto front. When you are in the Pareto front, you have different points. The ones that are in the card are not nominated. The ones that are in the middle are nominated. And what we want is to find the ones in the card. Okay. For instance, in this space, so here with the color is the number of solutions that are nominated in each one. So what you see is the ones that are not nominated are the ones that are here. So the competition was intended by economists because one, it was important to contribute to COVID, of course. But two, they have an algorithm and they want to know, because to evaluate all the combinations, it's almost impossible. You have to need very huge resources. But they want to know, with this approach, how far is the optimal. And when they show in the final presentation after the challenge, what they show is that combining the predictions of all the things, they can move the card from here. So the company also has obtained an interest because they can know a testing of this approach and this algorithm. So we decided to create a team and to participate, and we do participate. So on the one hand, because it was interesting about the COVID, and the other thing is that, I don't know if you have seen this video about the Steve Jobs, but Steve Jobs, you have a movie, you have a book, I like very much, but in this very short video, he explains that, okay, at some point you have to realize that people is ruling the world and taking the decisions, and they are not smarter than you. So when we were participating in the competition, we were not thinking our motivation was not to win. But our motivation is that we know that we can do it quite better. Maybe you cannot rely that or you cannot try, but you know that the others are not smarter, much more smarter than you. Maybe they have some more resources, but not at this point. And this also, we have the feeling because with Oscar, a month ago, before the challenge, we were winning a small prize in a physics challenge about anomaly diffusion. And the thing is that these models were the same one which were based in the prediction of machine learning. So how much do I have? 5 minutes?
8 minutes.
Okay.
Close to 10, but it's okay.
Okay, so the thing is that the challenge has two parts. The predictor, when we have to predict in countries and regions the evolution up to 6 months, looked at the beginning, I think the first models were just for a week or so. And here the prediction we're expecting for 6 months, which was quite huge period of time. So the thing is that here what you have is you have a number of cases, do a smooth, and the idea is the number of cases is proportional to the number of cases of the previous day. Okay, so the idea is you have a scale ratio. If this rate is greater than 1, there's an increase of cases. If this is lower, so this is decreasing the number of cases. Also, the thing is that the model, what was trying to optimize was almost the parameter beta that we have in the SEAL model. So very briefly, we have a population in a region J. People are susceptible, they can later move to infected, and later can be moved to recover. Okay? And this is related with the partial equation that you see, differential equation you see at the beginning. So when you discretize the difference, you can put that this derivative is the population in the time n minus the population in the time n minus 1. You move it here and you discretize it. So everything here, when you are integrating the data, the beta is Rn. And Rn is what we are going to predict. So we don't predict beta, but almost predict beta. And beta is included there. And when we have predicted this, what we recover is and we predict the new cases. So we are working with the rate that almost the rate that I mentioned at the beginning. And this is one of the things that personally I like because deep learning, we were using deep learning to predict parameters of mathematical models, which I think that is a different perspective that just predicting number of cases. So the architecture was based on 12 STMs, long short-term memories, with a dense layer after this, and later a lambda layer for combining information. Here, what you have in a branch is what you are introducing is the numbers Rn that you were considering, and later the action branch that was for each day a vector containing a school closing 0, workplace closing 1, and so on, right? So what was our proposal? We worked with bidirectional LSTMs and convolutional layers. That this was a similar approach that we was with the challenge in physics. And we saw that with this, we have very good results. We combined with dense layers, and the idea was to countries behave in a different way. So what we do is a pool of models and to try to see which countries behave more closer. We did it. The good thing about the challenge is that we do it in almost 3 weeks. We have experience in different parts, but we do it very quickly. But and the results were very, very good. We improved quite a lot of the money and the mean rank or the position respect the baseline that they provide. And it was clear that the strategy with clusters was good. Also, we do a validation with no intervention, frozen intervention, and with a maximum level of intervention. We were almost about to fail because we assigned wrongly the cluster to Belize, and we predict the collapse of Belize. As at some point, we don't know the metrics of the competition, but in one of the metrics, we were almost the last ones. Because we failed in this country, it was a big penalty to the result. But we decided to keep on working. Even this that work with the challenge, we use it in predicting the third wave in the Valencian region, and we know exactly what was the date that was going to be arrived at the top of the pandemic. And I think that the error, we commit an error of just 50 cases. And at the beginning, the epidemiologists were quite reluctant about the models, but after this, they saw that, okay, these people, we don't know what they do, but they try to do it quite well. And it happened just to, it helped the government to know exactly what the one that they have to take the decision and not to go further. So the prescriptor phase, we discovered that for every type or every combination of decisions, all the countries converge to some RN. And this was a key point, because we know that exactly RN was collecting what we expected about beta, that was measuring just the contacts between people. So what we have is this, I'm now going a bit faster, this RN. So what we wanted to know if this was the stringency between 0 and 34-fold, the NPI intervention. So most of them are here, but we try to do a sample of just to reduce this number of cases to the ones with lower stringency and the ones with top. And also we saw that what was the real impact of and what were the decisions that were taking more impact. And it was possible because we were gathering information about all of the world, many countries applying the same restrictions and what was the effect in the pandemic. So we saw what were the ones with more impact. We used for this a gradient boosting algorithm. However, with just a linear regression, you have a very rough idea about what is the impact of these measures. And so we started to construct Pareto fronts and to try to see the Pareto fronts, how to take in different models, how to take the best trade-off between each one. And this is more or less the structure that we have, is that you have the NPI space to predict the RN, you choose the importance of these features in terms of the RN, and later we try to integrate the info. At some point, it was possible to integrate this information, but it was at the part. And we try to provide 10 decisions. And in 10 decisions that you see exactly what was happening. So the idea is that for the one who's taking decisions, just to show, okay, you have a stringency here and the number of cases. I propose you 10 strategies that are good, are optimal. So you have to decide and take decisions. And you want to take the decision, so press A, you will see the evolution in the number of cases, and you will see what are the levels that you have to do. So this is, and you will see exactly what is the evolution in each country. So in the end, we won the challenge. We later were received by the president of the of the community, team of which, and we are all the team at some point were participating in different works along this period. And also our methods are quite fast because there was a limitation that we have to predict for every region in just 30 minutes. So it was to go very fast. Also in this work, it was also, I think, helpful to design an image to pay attention to the communication of what we were doing, to interact with people who was participating as well, to show how was our work. And well, we were also happy because at some point we were funded by the Fundación BBVA, CRUE, and Banco de Santander. It is along this 1 year and a half. And now, so probably you will see what can you say about the future. So about the future, in the last months, we have been working what happened with vaccination. And the thing is that despite all the people is working or speaking here about the 70%, the thing is that the models perform to have the error. The models that are more accurate is that if you are considering percentages of vaccination, the real effect is just 30%. What does it mean? It has to be understood in the following sense. The cases are increasing. The point is that we don't have a data structure into ages. So we cannot say they affect a different population. When the illness is emerging, or it has been emerging in different groups. Now it's the younger people. So the thing is that despite they are speaking about this, we cannot be relying because the people who is vaccinated later they get contagious. And this is something that at the beginning we were afraid and we were not understanding. And we were a little, okay, so what is happening? We saw it in February, in April, May. And now it has been discovered, you have seen that there are many words that they are saying that people is losing the immunity after some period after they get vaccinated. So the thing is, at some point, we will have to continue with the situation that we are. It's clear I'm speaking about cases. The impact of vaccines is really good for avoiding people go to have a very high level of illness. And also with predictions, we don't like to do predictions, but just to show the accuracy, I was interviewed by my local newspaper. I showed just to the journalist. I didn't say, but we don't speak about prediction. But he wanted to put the prediction. So at the beginning, we say that the number of cases at the end of August was between 500 and 700. Well, this is September, but if you see the graph, in the 1st of January, we were with, 1st of September, we were with 650. And as you see that this is almost stabilized. So the models are showing a good accuracy. And we are happy with this. So thanks for your attention.
That was a quite interesting talk, and also it's very important for the whole community to see how from the university, from research centers, we can help to the whole society. So thank you very much. Is there any question from the audience here, or if there are people that is virtually connected? Remember that you must raise your hand in Zoom in order to be able to talk. Okay. So, any question? Any comment?
Thank you very much, Alberto, for your talk. I think that was really inspiring, and I really enjoyed it. I found especially interesting the fact that you used different types of models for making predictions. The epidemiological models, environmental models, and I was wondering if is that possible to combine data from the different type of models, and what are the challenges that you have to face with that, considering that you are using different types of data and the accuracy of that data. So can you talk a little bit more about this?
Well, the thing is that at the beginning, you are thinking sometimes about the tools you know, And when I think that when we're working with the perspective of compartmental models, we just don't know exactly how to incorporate some information into the data. I think that the part of the machine learning or deep learning could provide us, despite it is a black box, sometimes they can show what is the way of integrating this information in order that you are predicting some part. Later, what we can see is what later we can try to use some model, kind of forest boosting, that try to explain a little more, or to try to see what are the real impact. But I think that this is something that, despite you are not knowing exactly what to do, I think that they can contribute from this part.
Because I think that the most difficult part should be that you have predictions, but for making prescriptions, you have mentioned that I think it's the most difficult part.
Yes, but the thing is that, but everything I think depends on if the data is well organized and well structured.
Okay.
Even at the first time that I saw the data of Oxford, it seems to be that it was just some numbers, some categorical values. You expect that there was a more degree. Well, there were 4 levels, but they can take many decisions. So at some point, you would like to have a model for Spain where you can try to measure if I'm closing at 10 o'clock or at 12 o'clock. And,
yeah.
Right. So the thing is that we are not arriving at this because we need a lot of information. Probably did some line to work, but we are almost working in this topic for free, and it was because we all were academics. But the thing is that I think that people have to decide how to organize information very well. Despite you don't know exactly how people will employ, that was easy to understand. Because if they decided in Oxford to use other type of more complex structure, probably it will be useless. But for instance, we have seen other works that can be done from the perspective of network science to see clusters of decisions or how people is taking the aggregation of decisions. Also, it has been very important that maybe you can have very few data from one place, but you have the opportunity to try to establish equivalence between different places and to try to organize and to gather.
In terms of context.
See. Yes. And I think that the idea of the Pareto front is very good because at least people want to decide. I think that people don't want, and it's irresponsible if a system is providing a unique answer. Because there are also some ethical issues. So the point is that if we organize, or I have the feeling that if we organize and we present information in order that someone has a human takes the last decision, this is good, and people will rely more that the system takes the decision. But I'm not a really expert in this topic. Is that my just personal feeling? But I think that politicians want to say what to do in the end.
Yeah. Okay, thank you very much.
Is there any other question? Yes, please.
Thank you for your presentation. You have told of non-pharmaceutical data, and is available publicly in Spain the non-pharmaceutical intervention data? It's
the one of Spain, but not for every community regional. So the point is that in December we finished the first phase. I think in the 17th of December, we were trying to do it or to adapt the information from all the communities and to try to do a model. But in the end, what we saw is that our resources were limited and we had to focus on, we were wondering, but we say, okay, it's something that we try to do the things and we try to see what is our interest. So we were not really asked to work on this type of models, but we saw that it was something that could be helpful. And I think that the good point about the politician and the Berenguer is that you rely, okay, so if you think that this could be helpful, so keep on working on this. And for us, it has been at the beginning, you can think about a scientist that you know what to do or what information. But I think that to be human or to be hearing what they are the really needs, I think that you can have more impact because this is more or less feeling the interest level of the people about the problem.
Is there any other question? In the virtual participants, is there any? Okay, Sylvia, please.
Yes, considering all the experience that the Valencia AI for Cloud team now has on this topic on how to predict COVID-19, I wonder what comes next. What are the plans for the future of the team? What do you know?
Good. So the team by now we want to give a model with vaccination. But the thing is that we have the feeling, and also my feeling with these pandemics, I'm going to speak from the more academic point of view. I saw at the beginning, in March, we saw very fast that people was uploading papers about modeling in arXiv, and at some point you will think that was quite reluctant about this, but in the end they have impact because people was interested in this. So it was the moment, and later it seems that people were doing almost the same. But to be the first at some point, or I think that in this it has shown that you can have more impact, despite everything was not really fully finished. So our idea, and we are know that are a little behind of this, is with vaccination. Is to try to give a model that to explain what are the best models from vaccination. The good models with this approach, what we realize that you have to consider very few percentage to discount or almost nothing. But the thing is that it doesn't mean, as I said, that this doesn't impact. It means that it fits better. And we are also working with the cases that you have a little more variability, and we don't want it to, in the part of academic, to be with the deaths. But these models, if you add, we are also have a model that if you add another layer, you can combine and you can have deaths. From the part of mathematics, I think that it can provide a good point for fitting dynamical systems. And it seems that that we are going to enter probably in a steady state, and we will have to focus more about the consequences. How to fight the consequences, how to gather information. Also, I don't know if this is a message, but I even think that the part of the COVID impact survey was sometimes, I don't know, but I have the feeling that you think about gathering information and you try to think about the system, very complex, very integrated, but if people don't feel the information, we have a problem. Even I think that when in September, September, we were deciding if to follow the idea of the tracing apps. And the idea of the tracing app, you have to install, and we saw that it was not the experience about the other. So the good thing about the survey is that people can feel you have the information, you have no compromise. Maybe you are lying, sorry. But the thing is that in the end, you have to try to provide a way to try to verify how it is. So the easier it was to gather this was important. And I think that the next part is what will be the consequences.
Unfortunately, we are very short of time. But just to probably to finish the last question, and I think it's also a mandatory question. What was the final impact of the XPRIZE competition or the award that you received? At the end, apart of the public recognition and with the money that you earn also for improving your work, of course. But what was the real impact? So did you export your model to other?
No, the thing is that well, it has helped us because I didn't put, it was in the last slide, but for instance, it appeared a paper in Wired in the journal yesterday or no, Wednesday, speaking about the experience of Valencia. So I think that we are a good example that the results of the pandemic were good, not only because of that, but we were providing a way to collaborating the researchers from the academic with the government, and the government that relies on the information. In our case, our models, so the thing is that in the end, this is a problem of resources, how much resources invest. So the thing is that we were not fully working on this. In fact, some people that was hired was without job during this period. So the thing is that we, in the end, were focused on just to make the predictions for the Valencia government. And the thing is that because we saw that there were some groups that at the beginning of the pandemic, they were doing predictions, even a group here in Valencia, and they were the journalists, the newspapers working, what are the predictions. So we avoid this because this was not our full job. So what should be and was a proposal, but in the end, it doesn't was supported, it's just to make an epidemiological observatory from data science with people that were supporting. But I think that, for instance, the efforts made by Oscar and with John Hopkins with this have give a lot of publicity for the university. And institutions, universities have relied on this. And when we speak with Chimo, we say, okay, why don't you have the Valencia model or the Valencia government? But it requires effort and people working a full time to do a very good tool. So the impact, to answer your question, the impact has been local because at the end there are demands. But even in this, we have been one of the groups in the world comparing the outcomes of the competition and speaking with other teams that have arrived more far away in translating their models to the political decision. And this was thing that was acknowledged for the judges of the competition.
So it's a good example in a path to follow for other researchers. Okay. So thank you very much. We must close the session. So thank you very much. For you. Thank you very much.